It's just terrible. Ice, but they tell you they're rising hours. Shuts it off.
We have two not here.
It is, it's really bad. But it's cheap.
Well, you know what they say?
No, I didn't.
Get Lee's attention. Just,
Lee, check in. Well, thank you.
Trying to the computer.
You got it.
It is now 6 o'clock. I'd like to call the August 12th meeting of the County Board to order. And join me in the Pledge of Allegiance in a moment of silence, please.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So on the roll call, it looks like we have two supervisors absent that let us know, and we have the one vacant. So we do have a quorum. Item 4 will be approval of the agenda. I'll entertain a motion to approve.
Spot second.
Okay, we have a motion and a second to approve the agenda. Questions, comments? If not, then I will call the vote. Okay. The agenda is approved. Item 5 is members of the public wishing to be heard. We have no one signed up. Item 6 is a consent agenda. I'll entertain a motion to approve the consent agenda.
Kelly seconds.
The motion and a second to approve the consent agenda. Any questions, comments? Okay, if not, then we will call the vote to approve the consent agenda. Okay. The consent agenda is approved. Item 7 are reports. One listed, department reports, monthly claims.
There's one claim in your packet. If you have any questions, feel free to reach out to Corporation Counsel.
Okay, thank you. Item 8 are business items. Item 1, Resolution 27-25, resolution to approve tax levy for salary adjustments in 2026.
Resolution number 27-25, resolution to approve tax levy for salary adjustments in 2026. Now therefore be it resolved that $408,113 of levy funding is hereby approved to be included in the 2026 proposed county budget to be used to cover the cost of the salary schedule adjustments effective January 1, 2026 and July 1, 2026, the across-the-board wage adjustments effective January 2026 and July 1, 2026, and the market analysis changes effective January 1, 2026, forwarded to the county board by the executive committee.
I will entertain a motion to approve.
Later so moves.
Michelle second.
Okay, we have a motion and a second. Who wants to speak?
So this is one of the key pieces when we start to assemble the 2026 budget. The county works off a grid schedule or schedule of wages for the employees. This was an updated market analysis that was completed earlier this year. In the resolution, it shows that we are proposing a 2% across-the-board wage adjustment on January 1, 2026 and up to 1.5% on July 1st of 2026. And then in addition to that, it's a 1% adjustment to the control point of the schedule of positions on January 1st, and then a 1% adjustment to the control point on July 1st of 2026. It's a little different than maybe you've seen in the past, that we are proposing a salary increase the first of the year rather than just in July. And that's in part because we anticipate instituting an employee premium for the health insurance, which would start at the first of the year. So to offset some of that impact on the employees, we're proposing the adjustments to start on July 1st of the year. We'll be bringing back that information for the health insurance at next month's meeting. There is in your in your agenda the market analysis information that which leads us to these recommendations, and I can have Tony present that information.
Are there any questions for Andy? Or do you want to wait till we have both presentations?
If you let her
Okay.
run through it quickly and
Yeah.
check questions.
All right, we'll wait till after.
Pull it up, so just give us a second.
All right. So here is the presentation. I'll kind of quickly go through it. I know we have a long meeting. This is the summary of what I put together, a little bit of history, and then a little bit of a summary to help you understand why the recommendation was made for the resolution. And so history for our market analysis. So this year we did a market analysis. We have a compensation plan and a policy and a salary schedule that was implemented back in 2013. We did another full comprehensive plan in 2020, so 10 years later. In between there were our market analysis, where we're just literally looking at the current salary schedule that we have and making sure that there aren't any tweaks. So you can see up there illustrated for you that quarter two of 2015, we did our first market analysis with the effective date of changes in the first of the year following that market analysis. And you can see the trend of that in the odd years. You'll see in 2021, due to COVID, we'd made a decision that year prior during the 2020 plan to schedule for our budget that year. We decided to skip doing a market analysis, so there was no change made. 2023, we did the comprehensive study, which was effective 1/1 of 24. And then today, what you have in front of you is the information from our quarter 1 2025 study that, if approved, would be effective 1/1 of 26. The next two pages, or this page and then a subsequent page in a few slides, are the history to give you a little bit more information than just the effective dates. It'll tell you the effective date on the left. It'll also tell you then the next column is the positions that were changed during that market analysis. So you can see all the different title changes that were changed. You'll see if the salary schedule had a change, because when we do a market analysis, the consultant will tell us if the salary schedule itself needs to change, which is the start wage, the maximum, the control point or position point. But they'll also tell us then how to move within the schedule. So the within the schedule by position is that second column, if there was a salary schedule change. And then was the county able to afford any kind of internal equity movement? So just because the salary schedule changes doesn't mean that people in the positions would necessarily change. And so you can see there that in the beginning, when we first did our market analysis, there was no change to employees internally unless they were below the starting wage. They got brought up to the starting wage. In January of 2020, what is that? It's 2019 up there. I'm sorry, 2020. We were able to make some minor changes. If somebody had 3 years of experience or less, they got a 2% above starting. And then if they had more than 5 years experience, 3 to 5, or more than 5 years, it was 5% above starting. And so we were able to make some tweaks. When we did our comprehensive study in 2024, effective dates, that's where you're going to see we were able to fiscally, I think it was almost $2 million or maybe just over $2 million. The county administrator and the finance director were able to bring a resolution and a presentation to the board. And we were able to make significant changes to the incumbents within the position. That is not typically something that we can do every year. So the market analysis for this current study that was done in January of 2024, because I wasn't able to put all of the information up there, I just listed it in this slide. So those were the 6 positions that had significant movement, because when we did our comprehensive study, we changed the whole entire schedule. So the schedule went from letters, A to double D, I believe it was. Now they're grades 1 through 26. When we did that big internal movement, you would have saw that anybody that had 6 years or more, if they were at position point or control point, they were moved to control point. But if they already were, they saw no change. And so this is an illustration of everybody in January of 2024 and what kind of fiscal impact they had because of those decisions. And you can see, for example, there were 41 people that had a 1 to 3% increase. You can see that there were 47 people that had 20 to 47%, which is the high. But then you're going to see we had 77 people that had a 0% increase. Most of those people have been here a long time, or they were department heads because they were in those positions for a very long time. And then you can see of those 77, 50 of the 77 were here 10 years or more. 51 of the 77 were in grades 15 through 26. So that's just an illustration of the people who didn't see any change during that 1/1/24 study. Now we're getting to the current. So the current study, this is the consulting firm, Cottingham Butler, our director, the person who led us in this study. Her name is Jenna Bidwell. The market data sources, that means where did we get all of the data? It was from the counties. So you'll see the Cottingham Butler custom survey. That's all the county data. And they don't pull from every county across the state. They pull just for those that are contiguous to us or similar like us. And then they also pull from private sector as well. They keep a database and then they make a recommendation based on all of that data. We have 61 benchmark positions. That does not mean we have 61 positions. We have over 100 positions, but we use their data and we benchmark 61. It's cheaper if we're able to not do all of our positions. And so we were strategic in how we picked those. And so of those 61, some of the examples of what I would provide is highway, for example. We have operators 1, 2s, 3s, and 4s. We also have machinists and welders. And so what we do for that position or those positions is we just have operator 3 evaluated. And then we place the rest of the positions as it relates to that operator 3. We also have administrative assistants 1, 2s, 3s, and 4s. We don't have all 4 evaluated. We have just operator or administrative assistant 3s evaluated. Similarly, my last example is social workers. We, instead of evaluating both social workers and case managers, we evaluate social workers, and then the decision is to place the case manager 2 grades below the social worker. And it's a way for us to save some money when we do our market analysis, but still have good data. Overall, our market index was 95%, which means that we're lagging 5%. And so the recommendation by the board or by the consultant was to make some changes overall to the schedule, which is in that resolution. What they did illustrate for us, and it's shown here, is grades 1 through 13 are more competitive, or are closer to market. You'll see that that's why they're closer to that 0%. And then grades 14 through 26 are actually a little bit further away from market. So again, this kind of illustrates why the recommendation is to change the progression adjustment to the control point on the salary schedule itself. So these are the recommendations in the resolution. I won't go through them again. I know Andy just went through them. And so for time, I'll just let you see what these are. And those are the positions that we're recommending to move a grade as well. What the hope is because of these recommendations is that in January then of 2027, because we aren't able to do the full recommendation by Cottingham Butler due to funding, we would like to potentially have that conversation then for the 2027 budget to make up the difference. So the control point recommendation is 1.75 by Cottingham Butler. We're going to propose 1% and then try to make up the difference of that 0.75 in January of 2027. And then the same thing with that control point. So that's what the green illustrates there for you. And then this is the same slide that I showed you a little bit ago that showed the history. This would be the 2026 and 2027 effective dates if those were approved by the county board. And this board would not be making a decision on the 2027. We're just illustrating what the potential recommendations will be in 2027. Today, you're just making a decision on 2026. And then the last part of the demonstration is to give you an understanding of the salary schedule. Right now, our salary schedule is, like I said, it is grades 1 through 26. That first one up there is grade 1. Grade 1 has a minimum and a maximum and a control point. On this salary schedule, this number here and this number here, the control point 1521, is the only figure on this salary schedule that changes. Everything else is driven by formulas. And so the consultant helped us construct this. And so basically, when we are bringing forward a recommendation for a 1% increase to the control point in grade 1, that's the number that we're increasing, this number only. And then the rest of the formulas will kind of populate. And how that it does that is it's based on the control point 1521. And so one of the other things that this will illustrate is the progression, the control point progression. Between each of the grades, our recommendation is to change it to 6.1% between the grades. Right now, it's 6%. And that is a recommendation from our consultant to actually move to 6.2, but right now we can afford 6.1. And so that's how the entire grid is structured. In addition, it has the minimums and the maximums. And so you'll see for grades 1 through 8 that are on the screen, they're 8% below the control point, and they're 20% above the control point for max. So that's your starting and your max. When I started with the county, it was set at 60% by the previous consultant. That is not a standard. That is not something that you usually see. And so we've been backing it off slowly to get to where we're at today at that 20%, which is very common and a best practice when you put a salary schedule together. The second page, the last page here, is an illustration of the higher grades, the grades in the 20s. You'll see that the control point you'll still see the first grade on the top, which is the minimum is 8% below the control point. But you're going to see that grades 20 and 21 are 12%, and 22 up to 26 is 14%. And that was strategic because of the positions taking longer to learn their role before they get to market. And so that was a decision that was intentionally made in conjunction with the consultant, so that as you go throughout the schedule, it takes you a little bit longer to get to starting. And with our structure and how we've been moving through the schedule, it's typically about 2% that we gain each year, because usually the schedule will move 1% and you might get a 3% increase. So you get a gain of about 2. So an administrative assistant 1, for example, they would be, if they started at starting, they would get to control point in 4 years. If you started as the jail captain at starting, it would take you about 6 years to get to control point. So those are just some other kind of structure illustrations for people. We've been giving this same presentation to our employees, and our employees have been really thankful and feel like they understand the salary schedule a little bit more. So thought we'd share that with you today. Any questions?
Okay, Supervisor Minen.
As well as the market analysis, in which I understand, and you want to be competitive with the other counties to prevent movement. And speaking of movement, do you ever use retention ratios as a factor when you consider the raises and where you're at as far as your control point? Do you ever track retention ratios?
Turnover?
Yeah.
Yes. Yep, we do track it, and we also present it to the board every 2 years during the orientation. Andy has asked department heads to start putting some other dashboards together, so I think there might be some data that you'll see more often than that going forward as well.
All right, thanks.
Supervisor Shoebridge.
2 questions. One, you mentioned we're 95% of a certain line.
Yep.
Usually wages are in a range. How does that line work? Is that like the average of all of our counties? Or how does that work? Usually it's like lower 50% or upper 50%, that kind of line.
So in your packet, there is a actual full document that was given to us by county. I think it's the executive summary. And there's a line chart that shows all the little dots. And so that kind of illustrates, I think what you're asking for is, we're not a line, obviously. We're a range, and there's positions that are falling into those. So some positions are a little higher, some are lower. The line is just an average.
So you say as a county, we're paying our employees about average of other
We're
companies,
about 5% lower
lower than average.
than the market, yes. And not just compared to other counties, but compared to their database, which includes some private sector as well when it's comparable.
The second question is, we have some employees, so this, you're suggesting we increase the levy, the taxes to pay for some of the stuff, correct?
Yes.
Okay, so how does that work when we have some of the employees which are paid through the state? So if the state fails, then those positions go away. Are they getting any benefits, or is the levy covering them? How does that work in this analysis?
See, on the resolution, under the financial impact, you can see that the total wage and fin cost is listed there, and then in parentheses, there's a number that takes into account other funding like grants, fees, state support. So then how much is actually going after the levy? So the total amount of wage increases doesn't go on to the levy, it's just the portion that's not funded by other sources.
So those numbers are broken out between those employees that are not funded by us and those that are, correct?
Yeah, in most cases, I'll just use the highway department as an example. We don't put the full amount of their increases on the levy because we anticipate that we get state road aids, grant funds. So I believe it's like 40% of their wages actually are levy increase, the rest is from other sources.
And then those employees which are paid through the state, are we paying their benefits, or is their entire package paid by the state?
It's still a percentage. I mean, that's why we don't have, I think, like our extension agents are not employed by us, they're employed by the state, so they're 100% state funded. Most of our other positions, we're paying it, getting a percent reimbursement for their total compensation. So, I mean, any benefits are rolled up into the total cost, and then what percentage is reimbursed by the state.
Okay, because the last several, I may be misunderstanding something, the last several positions we hired was all contingent on state funding, and I was under the impression that was 100% state funding and not our levy, not on us. So there's a distinct line between the state pays for this position, if the state ever stops, that position disappears. That's not levy money. So you're saying that's not true. There's nobody who's purely state paid, the levy covers everybody.
We just don't break it out like that. So you're right, like we have positions that we're going to request to add tonight, that's based on the funding coming from the program. And so if the funding goes away, we'll have to reduce positions. So it might be, it most likely would be the positions we're creating, but we don't attach like this dollar from the state pays for this person. We attach this money comes into this program. If this money goes away, we're gonna have to downsize the program by eliminating positions.
I think another good illustration is for the DHS. I think this is primarily DHS that we're talking about. And so their position-based budgeting report that I have to help put together with finance is the most complex document ever. And Bobby and I have to talk about it. Paul Brenner, who is in her department, talk a lot about it because one person could have 5 different accounts. They could have 5% here, 5% there, 20% in another area. So it takes a very long time to be able to put that together. So I think that might too be what you're asking is there's buckets that one person might be in, but the CCS dollars are 100% in one area.
They're 100% funded. I guess I want to make sure I'm clarifying position versus person. So if we lose CLTS funding, if the state cuts that, we're going to get less CLTS money in the fund. If we have that funded by the state, so we'll have to cut a position. But I just don't want to say.
Well, yeah, I'm trying to justify in my head how it's sold when we vote for it. Because whenever those positions are said, these are funded, and if this funding goes away, this position goes away. So in my head, that position is totally funded, everything by that, whatever money we're getting from the state. So apparently that's not how it works.
It is for that purpose. So, like, the 100% of the cost, like if we have a position, and it's funded by, let's see, I'll use CLTS again. When we file, we submit reimbursement or roll up all those costs for benefits and wages, and then we get that money back from the state. So that is 100% funded by state dollars.
So then those positions we're not,
Including any increases that we propose tonight. If we raise the cost of the benefits and the wages, then that's covered by the state program that's funding the position.
Thank you.
Supervisor Seidlitz.
I just, once again, just kind of have a hard time and feel like it's almost irresponsible for me to vote on this subject tonight because I feel like, you know, when we know that the employees' premiums are gonna get charged next month something, I have a hard time knowing the scale of what kind of money I wanna allow for, you know, to charge our taxpayers for this and hopefully compensate some of the employees for this, the premiums that they might be paying. I guess I'm kind of confused why we didn't put both of these in September. I know budgets kind of have to be done, but it would have been like, I thought more common sense, maybe putting both of these together in September instead of having this one in August, another one in September. Then all of a sudden, the employee healthcare premiums we go too low on and the taxpayers have to suffer on that end, you know?
So, I mean, part of the reason we're separating them out is wages, we're trying to maintain our wages to be competitive. We have an idea of where the budget's gonna come in, so that's why we're comfortable proposing what we have with the 2%, 1%, and the 1% to the grid, which is less than what the consultants recommended, because we're anticipating the other budget limitations we're gonna have, as well as the shift in some of the health insurance costs to the employees. So, I mean, if we put the budget together and we're short, I mean, we can come back and change the wage adjustments. But we're bringing this to the board so we have something to build the budget off of as we move ahead.
And like I said, my concerns, you know, before, you know, my concern is the people on the lower pay scale and the mid pay scale of our, you know, county employees. They might be a mass exit if the premiums have to go too high, but if we have too high of wages on the top end, you know, because we're going right across the board, because we're doing 6% or 6, you know, difference between each category or each step. I just feel like it's gonna be kind of hard on the people on the bottom because everybody's gonna pay the same amount of premiums. That's not gonna be a variable on how much you're making. And that kind of scares me on this whole thing.
And one thing I shared with Joel at our executive committee is these positions at the earlier part of the schedule, they are LTEs. They're not eligible for health insurance. So most of those lower paid positions are not on the health plan. So they're not gonna see that change. They're gonna see an increase in their scale, but they're not gonna have a change in benefits because they don't have our benefits. The first position that would get hit would be that custodian level position.
Which he's gonna get, you know, they're gonna get hit pretty hard because obviously their pay scales.
Not our custodian. I mean, I personally know who they are and what their situation is, and so they're going to be okay.
I know, but if they retire, you know, when somebody else comes in, we're looking at, you know, things like that. But I just, like I said, I think it's kind of hard to have an educated vote on this matter without knowing what the next, you know, step's going to be. That's all I have.
Okay. Thank you. Supervisor Hennick.
Tony,
Yes.
what is the cost of the health insurance raise right now? Tell me the total cost. And that's gonna be for every employee the same cost, correct?
No, it depends on the type of coverage that you have. So if you have single coverage, it's about 900 and some.
So if you have single coverage for anyone who has single coverage from the lowest to the highest pay scale is gonna pay the same.
Correct.
And that's true for all the coverages they choose, family, whatever.
Correct. Yes.
What is the family coverage for?
I'm looking at Leah. Is it 2,000-ish
Right now,
per month? I'm giving you monthly rates.
right now for family, it's $2,102 for 2025.
Right now? What's the raise gonna be?
So
It
just
all
to be-
depends.
Just to be clear, that's the premium right now that the county pays all of.
Right.
So we don't have the rates set for the split, the employee and buy some to the, the employer and have the employees pay some. We don't have that split figured out yet. We're hoping to get one more because one more month of, we had an increase at the beginning of the year, but it's been leveling off. So we're hoping that it is leveling off or going down, so the percent split will be less to the employees.
Without that information, it's really hard to make a judgment on pay raises.
You're not going to ever have that because everyone's situation is completely different. So we're never going to have a spreadsheet that says, here's my hourly rate and here's what it's going to, and here's what the elections are that you have today. Because the election that you have today might be different tomorrow, but in January, because me and my family might go to my husband's plan because of the rates. And that's what will happen is there's actuarial scientists that are looking at our plan and making assumptions based on where we're putting the rates on where employees will go. Some employees will go from full family coverage to employee child. Some employee spouses will go to single. And so there's some assumptions being made on all of that.
I understand that, but what I'm trying to determine, for the first time, employees are gonna pay a share of their health costs. That's pretty certain, correct?
Yes,
And you don't have any figures on that.
correct.
Yet we're asking to approve a pay raise based on information we. At 2.5% over a year pay raise. A person making $100,000 is going to get how much?
Say it again?
At a 2.5%, you're gonna get a 1 and a 1.5% this next year. So someone makes $100,000 a year is gonna get $2,500, correct?
Over the course of the year.
Over the course of the year. And somebody making $25,000 a year is gonna get,
$625.
and our pay raise, our health cost, probably is gonna exceed that $625, correct? Your best guess?
Yes, if you want an assessment, our pay rates for most employees are not gonna cover the potential increase in health insurance.
Right.
But
So-
again, like Tony was saying, we know where our distribution of plan holders are right now, who takes single, who takes family.
I understand.
When we roll this out, we're anticipating there's gonna be significant movement and people coming off family to employee, spouse, or even going to single plans. So that'll change, it changes the total distribution of how much the employee premium, or the health insurance premiums are gonna be.
So why are we, this is a big question that a lot of people are not gonna like, and it's real sad that I have to bring this forward, but why aren't we considering a flat rate for everybody instead of a percentage rate for everybody? A
So-
flat rate, if you take, I'm just gonna say you have $50,000 cash to give everybody. And the people at 2.5% at $150,000 a year are gonna get more of that 50,000 than a person at 25. Why haven't you considered a flat rate for this year only to mitigate the healthcare costs, where everyone gets the same amount of money?
So the illustration that I showed you in the PowerPoint here, this tells us that the grades that are higher are actually the ones that are furthest from the market. And the reason for that is because of what I also showed you on the salary schedule was that control point progression. Because it takes somebody who starts higher in the grades 8 years or 6 years to get to the control point where somebody so that was intentional to address exactly what you're saying. We don't want a schedule where the people that are in grades 1 through 6 are hurt because of people who are on grades 20 through 26. But what essentially happened, because of how the consultant helped us, we actually hurt the opposite. We hurt those that are higher because we had it so much further down, and the progression between each of the grades was too low. So the people that are at the higher grades are actually lower, and they're more further from the market than they should be. So because of that, that's why we're making that recommendation.
Okay. You still haven't addressed my question. If you're making $100,000 a year, your pay raise is gonna be, someone help me out here, I've lost my page. $2,500. If we get a $5,000 cost in our insurance, the person who is getting a $2,500 raise is still gonna pay $2,500 out of their pocket.
Right, you could have somebody who is a single at that rate, and they're not gonna see any change. You could have somebody who has full family. So it is a very messy dance to go through and try to figure that out.
Yeah, you're not answering my question. The person who's making a higher wage is gonna be paying less for their health insurance cost based on their raise than the person at the bottom. Still hasn't answered me why you haven't given an across-the-board raise to everyone for the same amount, so that everyone feels the same pain. I know it's a hard question, and I know that we have good people at the top that deserve this raise. Andy in particular has done wonders for this county. I am an absolute fan, and I'm grateful that we hired him. But the guy or a gal who's at a lot less is gonna take a greater, is gonna be, her years, her pain is gonna be harder because she's gonna pay more. She's gonna get way less of a raise. She's gonna pay a lot more money than the people at the top. And why haven't we split the pain evenly so that everyone gets an equal raise just this year?
I don't know if I have a good answer why we didn't. I would just say that regardless of which way we do this, that there's gonna be a handful of employees either feeling like they got the raw end of the deal or didn't get a good enough deal. If you know, the person, I guess, at the lower end of our pay scale might feel that they got a benefit, while the people at the upper end might feel that they are not getting adequately compensated because they're gonna get less of a raise.
Right.
It's gonna shift it to the bottom, so I would say, I guess, part of the reason we haven't considered it too is it just wouldn't be a kind of the norm to do in a grid system. You kind of distribute the percent increase equally based on their placement, the position placement within the scale.
And when we did this in 2024, remember, as I illustrated, the people who have been here 10 plus years or the people that are in grades 15 through 26 got 0. So in 2024, what you just suggested happened to a lot of our employees. 77 of our employees got nothing. And a lot of those were the higher paid individuals. So that already happened in 2024. So are you asking for them to do it again in 2026?
The higher employees get nothing.
That's what happened though in 2024.
Well, I wasn't here in 2024. I'm here now.
Right, I'm just telling you, so it's already happened.
Not giving me legitimate questions to answer. Of the total pay raise, we can't control the healthcare costs. There's nothing we can do about that except be wise and shop around. But we do have a total amount of money that we're given to the county in total. I'm gonna call it $1 million because I don't know the figure. People at the top are getting bigger percentage of that than the people at the bottom. To ease the pain this year, why haven't you just taken that $1 million and split it among the 300 county employees evenly, or whatever amount we have? Yes, everyone's probably gonna be paying, if even at the top, if we're getting a $5,000 pay hit on the medical costs, even the person making $100,000 a year is still gonna pay. But the person at the bottom is gonna pay a lot more, like a whole hell of a lot. By splitting the total cost of the raise among the total people, everyone gets the same raise, and everyone's gonna pay a little, have a little pain, but the people at the bottom are gonna have a little less pain than the people at the top. I don't particularly like that wink. This is a serious issue, and don't make fun of it. People at the bottom are gonna be hurt, and that was inappropriate. Now, I know you don't like what I'm saying. I'm not trying to punish anybody, but I'm trying to protect the lower end a little bit, where everyone makes a sacrifice, a shared sacrifice. So, that's what I just have to say.
Supervisor Flynn.
Thank you, Mr. Chair. Have we discussed, or are we gonna be looking at shopping insurance plans to see if, I know in the past, we've been able to keep the cost down, and I know once in a while you get a hiccup year or two where you can't. And I'm assuming that we're in the process of shopping or looking for other plans to see if we can actually lower our costs, because that can happen. That's what I do for a living. So it's like it happens with some of mine, but not always. And then my other question is multiple plan options, because even though we're talking about people at different, income levels, a lot of people have different health issue levels too. So if we're offering multiple options with, a higher deductible option or a lower deductible option, that could help people by doing that as well, or maybe that's something that you've had in the past. I haven't looked at your insurance for a while, so I can't remember how it's structured. So, and those are just suggestions that I'm bringing forth, because those are ways that you can also help out with, some of the conversation that's going on right now too. And I know you've, shopped the stuff in the past, and I'm just saying, this is kind of a year where I'm starting to have to shop all my cases right now too.
So we did do the shop. I can't answer a lot of these questions because health insurance isn't on this agenda.
Right.
But we have shopped health insurance.
Huh?
And we are we're exactly where we should be because everything else is coming in higher.
Okay, thank you.
Supervisor Kelly.
Thank you, Chair. How many employees are, I guess, here underneath this raise or would qualify for the raise?
We have, right now, I think we have 425, 440, maybe we have 435 employees because of the seasonals here right now. But we're usually ranging between 420 and 435.
435.
Health insurance qualified eligible employees is about 360 to 380, depending on the year or the timing.
So it's like $1,900.
We have a lot of LTEs and part-time employees.
So $838,000 is what's proposed for this wage increase, right? And then, huh? Well, that's two parts. Two parts of it's, the whole thing, right? So it's like $2,000 a year. So we're just talking what is that?
For all of next year.
Yeah, for all of it, right?
Yes.
So is it like $1 an hour? So if you just raised everybody's rates flat across the board, $1 an hour, yeah, it's gonna make somebody a little upset at the top, but $1 an hour to somebody that's making $25 an hour is pretty decent. Just a thought. And then the other part I have is, are we still on the downward trajectory for being way over budget on our healthcare costs, like that we were overpaying?
And health insurance is not on the schedule, so I'm not allowed.
I mean, like,
We can, it's part of compensation, so
Yeah.
unless the corp council wants to stop it. I mean, we were over budget last year and we're over budget this year, but the amount we're over, and I shouldn't even say over budget, we were close to 20% last year, and this year about half that. So it's coming down, but we're still over budget.
Supervisor Sedlitz.
Yeah, I guess, the healthcare is always the variable, and it's a hard variable when you're talking about wages and stuff, but I guess piggyback on Ian David here, looks like it was, these wages would, cost the county about $400 and some thousand if you have 380 employees. Instead of giving raises, freeze the wages, wouldn't we be better off giving, $10,000, towards, like vouchers to pay their premiums to each employee or, over the year? As they stay, give them, something to help pay their premium, that way nobody gets hurt and
And I think
people
maybe, say one of the reasons we've kept these separate though, is that health insurance isn't just about, it's a spend for the county, it's gonna be a spend for the employees, but part of the changes we're trying to make is to change the utilization of the health insurance, and if we're paying the premiums, it's not gonna change any of the utilization. So we're not gonna see any effect on the cost of the health insurance.
So what I'm saying is they still charge them a premium, but they'd have this money to put towards their premium instead of, giving them a raise, because I'm telling you, you give somebody at the bottom a little raise, it's gonna affect them a lot worse than somebody on the top. And I get it, the people on the top haven't, had their 2024 freeze, but we're also not Eau Claire or Dunn County, we're trying to run in the black and not in the red. And, I'm just looking at it that way,
No, and to your point, there is no doubt that implementing a premium that they're not paying now like you said, single premiums are gonna be the same regardless of where you are in the pay grid or a family. It will have a larger impact on lower wage people than the higher. There is no doubt about that. If you went with, rather than across the board 8% increase, just an across the board raise that everybody gets, in the long run, you're gonna hurt your competitiveness for the higher wage positions that start to fall behind. And those are the ones that generally are harder for us to retain and recruit because of their usually degree requirements, certifications, licensing, demand from other employers. That would be, I think, the biggest impact I would see about doing a flat across the board increase to individuals is you're going to reduce your competitiveness or your competitive wage for the topper, you know, and I don't know where the split is. If you did like you divide the total number, I don't know where, you know, who would make less and who would make more than the across the board increase, but you're reducing your ability, you have to probably do bigger increases later for the higher end of the scale because of that.
And right now, what we're doing is we're educating our employees. I have 11 meetings. I'm halfway. They're an hour and a half each. Just went to the highway at 6:15 this morning and again at noon, going back again at 6:15 tomorrow. I've had 2 evening meetings so that wives and husbands can come as well. It's been well received. We've had some great questions. It's super transparent. I feel like our employees are super educated. They know the data probably better than you guys because I don't have an hour and a half to teach you all of that. Maybe I can send you a video, and if you really want to watch it for an hour and a half, you can kind of hear about the numbers and the why and answer a lot of your guys' questions. But I feel like our employees are coming along. They really do understand that we have a claims issue. We don't want this. Every decision maker that has been putting and racking our brains in meetings constantly to bring this to you today with the market analysis and next month. I mean, we literally say the words, this sucks, because we don't want to do this. Our county, or our broker has been telling me that we should be charging premiums for the entire 8 years I've been working with him because of the status of where we're at today. We have every person pretty much that works for Chippewa County and their families on our plan, even if they don't need it, because it's free. And you go to the grocery store, if it's free, you take it, even if you don't like that product. And that's exactly what's happening. So we need a premium. And so that's one of the reasons why we want to do this. But we're trying to make sure it's fair and equitable. And our employees are understanding. They really are asking great questions. Even the highway guys who normally are quiet when I go to their meetings, tons of questions. The most questions I had was today from the highway group. So I really think that they're coming along and they are understanding. My department has all of the wage schedule, and we're all talking about it and understanding kind of where we're going. Not that there aren't people out there who are frustrated, but.
And I'll just reiterate too, like, what we proposed in the wage increase resolution is based on where we think we're gonna come back with the health insurance, based on the amount we're over and using the actuaries, the consultants we have to impact, the distribution of family plans, implementing the employee plus spouse or employee plus child single plans. We expect some movement because overall we're trying to bring the healthcare costs down. Like Tony said, we know we have situations where a family might have multiple health insurance plans. Ours doesn't cost anything, so of course they sign up for us. And they might not even use it, but in addition to that, we pay them out a couple $1,000s in HSA because they're eligible for it if they take our health insurance. So we are trying to impact their decision-making on a spouse plan or a county plan or having a single plan from each employer, or trying to make those, help us in our financial situation and also limit the amount of health insurance costs they'll have by choosing a plan that maybe isn't the county's that still gives them adequate coverage. If you delayed this resolution or turned it down, we're still gonna kind of base what we come back with health insurance next month on these numbers until we have other numbers to work off of. And again, the reason, this hasn't, as I understand it, always come to the board together. Sometimes they have been separated because maybe health insurance data isn't always available when we need it. But our intent by waiting a month is to hopefully continue to see that arc coming down so that we can limit the amount of percent premium we apply to the employees. We don't want to shoot over the top because we think it will affect our ability to retain employees. We're trying to find a medium, and I'm not even called a happy medium, to making sure we're still competitive on wage, but are distributing our healthcare costs so that the employees have some and the county can still afford the employee part of the premium.
The across the board's always been July 1, and they all know that we're bringing a 1/1 and July 1, and they're very thankful for that, and that the intention was to try and help curb some of that increase in the premium. And so I think, unfortunately, what they would hear today, if you didn't, not that you have to approve it, but if we didn't, I think that would be the stir is, oh my gosh, what are they going to do? Are they not going to approve? You know, so that's the one thing I don't, we'd have to make sure that we message that you guys just want to approve them together if that's a decision that's made or what have you, because I think they have their hopes up that it's going to be a 1/1 and July 1 increase. So they were very happy about that.
And we still have 2 months before we put the budget to bed and present it to the exec committee to come to the county board. Obviously, we're watching the moving pieces at the state budget that's coming out and whatever happens at the federal level. To the question earlier about state or outside funded positions, we think we know what the impact is, but if things change tremendously with any funding that we anticipate, we'll be back to amend everything as part of the budget process. I think that's noted in the resolution that these aren't final until the budget's approved and adopted.
Supervisor Hennick.
You said that you were at a certain point in this state as first, fifth, 10th. Where are we at financially in this state do we stand? Where do we stand as pay and everything approximately?
That's a really hard thing to answer.
Okay.
I'm trying to think of, like, you're asking, like, is our pay?
It's not that important.
Here, I mean, we can tell you anecdotally, like, we pay less than Eau Claire. We pay less probably than Barron, but we pay more than every other county around us.
Gotcha.
You know, but I mean, we're in a very rural part of the state when you get further north, so we're better than all those. But any bigger county,
So that's fair.
That was fun.
Okay, you talked about the cost of medical usage. Where does that divided on? Can you give me from the lowest employee to the top employee, can you give the usage of that insurance? Where do you see it?
That would be HIPAA information. I don't even see that data. That's only privy to the provider and our broker.
Oh, so you don't know if,
I don't know if Linda back there had a colonoscopy yesterday. No.
gotcha, so you don't know who is going to.
Smiling, though.
tell us like 25 employees or like up to 100%. The best they can do is usually tell us like 20% of the employees incur 70% of our total cost. But we don't know where those employees are distributed on our salary schedule or.
Supervisor Shoebridge.
Well, one comment. So one thing I'm hearing about the medical, so if you only compensate the raise through the medical, then somebody who doesn't take the medical doesn't get a raise. So by giving them a pay,
Everybody gets the raise.
just want to clarify through
Okay.
them. So it sounds like they want to say, well, you just put that increase towards the medical to help them out for that. But if you give it directly into the paycheck, they choose to put it back into, that compensates for that premium coming. But if they don't have medical, they still get a raise. And so if you, just kind of a point over here, so you don't want to get too focused on medical alone, which I understand it is real important. I just want to clarify, so there's been no raises since '24, and then this will take place in '26.
Nope, everybody just had a increase on July 1st of this year. All of our employees got a 3%.
25, okay. And then this will take place in '26.
Correct.
And then you're seeing a 1% increase off that median.
That's just the salary schedule change. That's not the increase to their wages.
Okay, so that's my question then, is that, so what percentage of the rate, well, it depends, I guess, if they're below or above that line.
Correct.
Depends on the percentage raise.
Yep, and that's why this is so difficult. Everyone's situation is going to be very different. You're going to have people who don't want our insurance in low grades and high grades. So some of them are going to get all of their increase, and it's not going to make a fiscal change to their pocketbook. Others have full family and no other options, like myself, and I'm going to take that whole hit against my wages. Other people might have the ability to move, so it's really different for.
No, I can't vote for a 2% raise for everybody, because that's not how it works. It says we're just voting for a raise off that base. So that's what's causing some confusion, I think. So, thank you.
And so that another kind of data point is most employers do not give hourly wage increases. They give percentage wage increases, whether it's pay for performance, whether it's 2%, 3%, 5% based on your performance, but 95%, it's a percentage. So this is very standard. We're not doing something to harm employees that are lower paid or higher paid. It is the best practice in compensation. And the schedule's built because that's how we pay. That's why those takes so much longer for those at the higher grades to get where they're at, because that's how we pay. So it helps to make sure that we're not giving all the funds to those higher paid employees. I feel weird talking about it because I know I'm one of those in the 20s, and so, but it is factually how it was created.
Okay, just before recognition, is there any other supervisors that want to speak on this? Just a reminder, we have, our board rule is we allow all supervisors to speak no more than twice until all others have been heard.
That's fine.
And I'm just asking if no one else wants to, then you can ask and ask to speak more than that. I just want to make sure if there's any other supervisors that haven't spoken twice would like to speak.
I'm good with withdrawing.
And you can,
I'm good with
okay, all right. Thank you for the discussion. Good discussion, good questions. So we have a motion on the floor to approve Resolution 27-25. I guess I will call the vote. Yeas are 13, the nays are 5, so the resolution is approved. Item 2, Resolution 28-25, resolution to create a full-time social worker position in DHS for CLTS.
Resolution number 28-25, resolution to create one full-time social worker position in the Department of Human Services as part of the 2026 budget process. Now therefore be it resolved that effective January 1, 2026, one full-time social worker position is hereby created within the Children's Long-Term Support CLTS program in the Department of Human Services to provide case management and support services to children with disabilities and their families. And be it further resolved that this position shall be funded by Medicaid revenue generated by this position. And be it further resolved that should the state and federal support necessary to fund this position not be available or be reduced significantly, this position will not be filled or may be eliminated in the future by the county administrator. Forwarded to the county board by the executive committee.
Lynn seconds.
We have a motion and a second on the resolution. Who wants to speak first?
I'll just, a few comments, and then our Human Services Director is here to answer the detailed questions with the program. So as it states, we're just experiencing increased caseloads in our children's long-term support. We're trying to keep the caseload within the boundaries that's established, recommended by the state. Right now, we're averaging 33 cases per worker when the recommended amount is 20 to 32. And on top of that, we're getting 20 new referrals per month, 10 waiting for enrollment, and 13 still have to go through screening. You know, as it states, this is long-term support, so these cases don't drop off very quickly. Generally, we're building up a case roll. We are required by the state not to have a waiting list, so that's why we've been staffing up this program. And as stated, if for some reason the billings that support the position or the funding goes away, this position would be eliminated. And just to go back to the earlier discussion, you know, we submit all of these bills for reimbursement to cover the program costs. If those go away, then we'll have to reduce the program by eliminating this position. Just wanted to clarify my confusion that it's not always going to be the person that we hire for this job, but the position would in that area would go away if it's not funded anymore. And that's my job, to present to you a balanced budget and maintain the finances of the county, that if we pass resolutions like this and we don't have the revenue to support this position, it's my job to get rid of it so we stay within budget. But I think any specific program questions or CLTS would be better addressed by Bobby.
Are there any questions anyone would like to ask?
I do. Just on line 62, then, can we get that, maybe eliminated, I guess? Can we get that changed to will be eliminated? That makes us kind of,
I think the May is only in there in case I can find other funds to support it. Like that's your prerogative. It's not gonna change the functional perspective of the resolution.
perfect, thank you.
Supervisor Hennick?
This is CLTS, right?
Yes.
I'm a supporter of social services.
I'm sorry, Mr. Chair and Mr. Hennick, that seemed like a motion. Like that, what, just making a statement does not change what's reflective in this. If that was a motion, it needs to be withdrawn. If I misunderstood him, I apologize, but I feel like we have a motion on the floor. Is that what your intention was?
Yes, I should-
Was your intention to change it
Yes,
officially?
I'd like to make a
Oh,
motion.
sorry, I didn't hear a motion.
Oh, yeah, sorry.
Gotcha, that's fine.
I can second it.
Motion to amend.
Motion to amend line 62
Sorry for the interruption.
No, that's fine.
to remove the word may and change it to will.
And I'll second it.
Okay, one motion, second to modify as described. Is there any questions or discussion on the modification?
I just want to know why we want to, because like Andy said, if we have May, I know we're always looking for other funds, so why would we want to automatically, because then we're going to have to vote on getting another position if they find more funding, so why get rid of it, I guess is, if it's so black and white, we're going to get rid of it. Whereas May, if we find funding, we keep it, otherwise we have to vote on it all over again and everything. I guess it's not really a question, that's just.
Andy, would you like to address that question?
I don't have anything. I mean, yeah, I
Okay.
think that's why you're right, the May is that this funding could be eliminated and we might find other funding to support it. So we wouldn't eliminate the position in that case.
Because by leaving May in there, you allow that levy to fill in that gap later. We may eliminate, or we can just pull from the levy or pull from other areas. That ambiguity allows you to do that. And so that we want to make sure that is not the case. So if we put other language in there, if it cannot be filled by this funding or other funding, then we can pull it out. That's the concern.
Any more questions? Oh, sorry.
If I may. Yeah, I understand where that's coming from, but my concern would be is, our administrator is, in charge of that budget element, and say this funding does go away, but the need for this outweighs the need for something else. I still think that our administrator should, at a minimum, have the ability to at least come to us and say, this is what I'm looking to do. I know this said may go away, but he still has to stay within our budget. We can't legally approve a budget in the red. It has to be balanced. So I would rather leave that responsibility with our administrator, and that he or whenever she would come back and say, hey, we need to do this, and this is what I recommend, we'd still have a say in the process. It wouldn't be pulled from us completely. I think flexibility here is better than an absolute in this scenario.
Supervisor Seidlitz.
I guess my thing, I'd like to see it will in there is because we don't have a crystal ball to know what's going on. And we're only like 6 months away from the next election. None of us might be in this room. And if that got eliminated, why can't the county administrator just bring it to that next board and see if they want to approve that position instead of us sitting here saying that the county administrator in it? because at the end of the day, he could always bring it into the next budget or present it to the next board. That's all I have. That's why I like Will, I guess, in there.
Supervisor Hennick.
I hear what Joe and Dave are saying, but this isn't like before. We have Andy here, and I trust him. That's all I have to say. I'm good with his word.
Supervisor Flynn.
Thank you, Mr. Chair. Could someone just clarify the vote? Yes is supporting this and no is supporting this. Could someone give a upgrade on that, please?
Yeah, the vote is for modification, and I believe. Pardon? This vote is just on the modification. The modification, I believe, is removing the word may and putting in the word will. Position will be eliminated instead of may be eliminated. That's what this vote is for.
Yeah.
Is that clear?
No,
Pardon?
no,
Presently, the motion's on the floor to modify the original motion we had to approve the whole thing.
so yes is to modify, no is to keep it as is.
Yes, no is to keep it as written right up there.
Okay.
The yes vote is to replace may with the will be eliminated.
Thank you.
That capture you right? Okay. Okay, any further questions for this vote? Okay, we will call the vote for the modification. Okay. Vote is yeas are 5 and the nays are 13, so the modification does not go through, not approved. So we're back to the original motion to approve the resolution as originally presented. Any discussion on that? Any further discussion? I'll wait till the screen changes. That's what I missed the last time. The screen was up.
Didn't take it personal.
Should have. Okay. If there are no more questions or discussion, then we will call the vote to approve the resolution as it was written. Okay. Yeas 17, nays 1. Resolution is approved. Item 3, Resolution 29-25, resolution to create one part-time elder benefit specialist in DHS.
Resolution number 29-25, resolution to create one part-time elder benefit specialist in the Department of Human Services as part of the 2026 budget process. Now therefore be it resolved that effective January 1, 2026, one part-time 1,500-hour elder benefit specialist position is hereby created in the Aging and Disability Resource Division of the Department of Human Services to provide elder benefit assistance for consumers. And be it further resolved that the funding for this position is expected to be supported by an anticipated increase in the 2026 ADRC base grant from the state, along with federal Medicaid match dollars. And be it further resolved that should the state and federal support necessary to fund this position no longer be available or be reduced significantly, this position will not be filled or may be eliminated in the future by the county administrator. Forwarded to the county board by the executive committee.
I'll entertain a motion to approve.
Later, so moved.
Goodman, I'll second.
Okay, discussion?
Yes, like the last position, this is again is a demand-based request. We're experiencing an increasing number of individuals requesting service through our ADRC for the elder benefits. As noted, it's an 81% increase in the last 3 years. That's anticipated to increase. If you all recall who you were here, I think in January, February, you saw the presentation by Ford Analytics and as to where the population of the county is going. We're getting the balloon of the boomers into their senior years, which is creating additional demand in our ADRC. So this position would be a part-time 1,500-hour week position funded by non-levy dollars again of the ADRC base grant along with the federal Medicaid. If those don't materialize or they go away in future years, then this position in the program would be eliminated. Unless other funding or some other source revenue is available to supplant the base allocation and Medicaid dollars.
Any questions on this one? Supervisor Hennick.
Could you clarify the hours? I didn't quite hear that.
It's 1,500 hours a year position, so it's a part-time position.
How many hours a week?
I think it's going to vary, but I mean, on average, you're looking at 30 hours a week.
Okay, it is 30. I thought I read something earlier, it was 9, so
No,
I have no withdrawal.
that's what we currently have now is 9 hours a week. So this would increase it to 30.
Gotcha.
Supervisor Romeyer. Oh, sorry. Were you finished? Supervisor Hennick, you finished? I didn't.
I'm finished.
Okay. Supervisor Romeyer.
Andy, with the Medicaid cuts, where do we stand as far as the possibility of this grant funds? I know it's difficult.
Yep, as I say, it's $1 million question, but it's probably $1 billion question. At this point, we don't know, but we're not anticipating any decreases for next year. We anticipate if we're going to see reductions or individuals access to Medicaid, Medicare dollars, it's not going to be until 2027. And then even then, it's going to depend on what the state's going to do. The state's going to potentially lose that funding, and then they'll have to decide if they're going to replace it with GPR. Sure, Senator James is loving to hear this. How does the state react if they have a loss in funding? Because most of our dollars, not most, but a good portion of our dollars come through the state. So they could replace them and we don't see much of an impact. But at least right now, we're not projecting anything for next year.
Thank you.
It's not a clear crystal ball at this point.
Any more questions or comments? And then we will call the vote for Resolution 29-25. Okay, the ayes are 17, nays are 1. The resolution is approved. Item 4, Resolution 30-25, resolution to create a part-time legal secretary position in the district attorney's office.
Resolution number 30-25, resolution to create a part-time legal secretary position in the district attorney's office as part of the 2026 budget process. Now therefore be it resolved that effective January 1, 2026, a part-time legal secretary position is hereby created in the district attorney's office to focus on administrative support for the district attorney and/or assistant district attorneys. And be it further resolved that this position will be funded in 2026 and going forward by levy dollars, forwarded to the county board by the executive committee.
Entertain a motion to approve.
Motion to approve.
Second.
We have a motion and a second. Okay, discussion?
So this is levy dollar supported, however, it's not new levy. The administration had been working with the DA to get to a 1-to-1 staffing ratio between legal secretaries and DAs. So they had put some money in the budget prior year. At this point, like you've noticed, we're not pushing ahead any new positions that would require additional levy dollars. But seeing as the levy money is already in the DA's budget for a part-time position, position had not been authorized previously, just the money put in the budget. We're recommending to create the one part-time position to get the office closer to a 1-to-1 ratio between legal secretaries and DAs.
Any questions? Supervisor Schubert.
My main concern right now is we're increasing levies, we're increasing taxes, bringing in people. I don't think new positions at this time I've already talked to some of our city people, board people, managers, You know, and they say, how come the county board doesn't do what we have to do and tighten the belt and work things out? The pay increase I'll have to answer for already from 2 of my cities, and this one's gonna be really hard to swallow.
Okay, any more questions? Comments? If not, then I'll call the vote on Resolution 30-25. Okay. Yeas are 16, the nays are 2. The resolution is approved. Thank you. Item 5, Ordinance 6-25, ordinance to amend Chapter 30, Article 2 of the Code of Ordinances regarding non-metallic mining, second reading. And we will, after the reading, we will ask for a motion to approve the second reading. You don't do any?
No, we'll just leave the motion.
Okay, since this is the second reading, I guess we just look for a motion to approve in a second. Discussion.
Omar seconds.
Okay, now we'll have discussion. Thank you.
I'm Trenton Shutter, project engineer for LCFM. I'm here to answer any questions on the second reading.
Have any questions or comments on this? Everybody's read through it completely, understand all of the nuances, non-metallic mining? If there's no further questions, then I will call the vote. Okay. It's unanimous, 8-0. Resolution is approved. Thank you. Item 6, facility use policies, first reading.
Who's doing this? Is Scott
Scott.
coming up?
So this is a amendment to the revision to the facility use policy to bring us in compliance with the county ordinance 2-462 for the concealed carry.
There's a brief explanation of it. You show the changes, just have a brief explanation. Oh, just a wordage of just,
Well, so prior to it, it had weapons and firearms are prohibited in all county facilities unless possessed by licensed law enforcement professionals on official business, and then changed to the wording of except as provided in Chippewa County Ordinance 2-62B2, no person shall possess, carry, or bear a weapon, whether concealed or unconcealed, or contraband, or any other prohibited item within any county building.
okay. Any questions or comments on this? We're not voting at the moment. This is the first reading.
Yes.
Supervisor Hennick.
I think there's gonna be some anger when it's not gonna happen early this year, but I think next year there's gonna be a lot of people losing things from different cuts. This isn't exactly maybe the place to go, and I can talk to you later about it. How long before this gets in effect? Because I do think we're gonna need it sooner than later.
This will be what? This
After
is
the second reading.
Normally, the second reading would be next county board
the
meeting.
county board, yeah. Okay, yeah, it's making consistent with the ordinance that has been passed.
Thank you.
Supervisor Shoebridge.
This may be for the second one as well, then my concern is that it's somebody who has concealed and carried, they are legal, they are part of the defense of our communities. And so by doing this, we are taking full responsibility of any danger happening to anybody walking into our building. That is the law. So if you prohibit conceal and carry, that means if somebody does get shot here, the county is fully responsible for that happening, because you're fully responsible for the safety of everybody in this building. So by adding the not allowing conceal and carry, we're putting that risk upon ourselves. So I don't know if you guys know. So if McDonald's we do not allow guns in our store, they're taking the full responsibility of your care. You go into McDonald's and you get shot from a crime, McDonald's is fully responsible for that, legally. So we are doing the same thing here as well. So that's my concern.
Supervisor Bergeron.
Thank you, Mr. Chair. Just for clarification, this language already exists in County Ordinance 2-462, Parent B, Parent 2. This is a housekeeping element. We've already voted on this as a board, and it is the rule of our facilities currently. This is a housekeeping element. Thank you.
Okay, any more questions? Okay, thank you. Item 7, HR Policy Manual Revision to Conceal Carry Policy, first reading.
Right, similar to Scott, there's also some changes. This isn't concealed carry. We have a policy in the HR handbook, and we're just citing and referring to the ordinance. So it's a very similar housekeeping issue. There's not a change to what is currently in practice. Our employees aren't going to have to do something different. We're just citing the ordinance so that it's clear and clean. I believe Todd worked with the judges, and there was a process that came up with this language for council and the courts.
And this is the first reading. Any questions, comments? Okay. Item 8. Again, HR policy revisions, care navigation and pets in the workplace. First reading.
All right. So the first policy up there is care navigation. So as part of our health insurance plan, because we're self-funded, we are able to offer a couple other different unique benefits. One of them has been care navigation with a company called Alethius. And so that's what we partnered with them a year and a half ago. And we are going to be moving away from care navigation from this service provider due to some administrative errors and problems that we've been having. And we're going to be going to a company called Amplify to offer a tier 1 network. And so we have incentives that we asked the county board to approve that were related to the care navigation product that we were offering. And since making this change, we've changed the policy language so it says care navigation or preferred provider incentive, because we still want to offer an incentive, but it's not a care navigation provider. And so this is an example of when we create a policy for the first time, we created really specific to the issue versus it being a little bit more broad. So we just buttoned up some of that language so that it could apply to either type of product. And then if Tracy could scroll a little bit further down, we removed and struck a large section on the procedure related to using Alethius, because that is completely not applicable anymore to Amplify, because Amplify is a network and it'll just very seamlessly run through our insurance plan. So we removed the procedural stuff out of the policy. And so essentially what this policy will be is the board approving to have an incentive to entice employees to use a tier 1 network, which are providers that are not part of a system and that are low-cost, high-quality providers. So it's very similar to Alethius. It's just a different type of language that they use to call it the preferred provider network. So that's the reason for those changes being recommended. This is just the first reading, so if there were any questions.
Any questions for Tony?
The second policy is pets in the.
Yeah.
Sorry, we did have.
Hey, Tony, is this basically the same benefits that they had in the other one?
They're slightly different. They're getting incentivized, though, to go to low-cost, high-quality providers.
But it's still an okay policy.
Yes, 100%. Definitely support this policy. The next is pets in the workplace. And we've had an increase of pets in the workplace and pets who've maybe left some prizes in different departments. And so because of that, we've been having some conversations. The courthouse security officers came to us asking for some tweaks to the policy. Our policy was pretty strict and specific about what you could and couldn't ask of people coming into the building with pets or with an animal. And so we've buttoned it up to give some ability for the security officers as well as employees. It doesn't say shall, so it says that they may ask several questions. And so that's what's listed here is what's acceptable by law to ask. We don't allow comfort animals or pets in the building, but we do have to allow service animals. And so there's a couple questions that we can get at, and there's a couple things we can't do. And so there'll be some education that goes out to employees after this is approved, if this is approved, to make sure that they are empowered with that information. Any questions?
Okay, any questions on this? Okay, thank you. Item 9 is County Board Chair appointments. Item 1 is the County Board Chair appointment for District 5 Supervisor. I will entertain a motion to approve.
Waiter so moves.
Second.
Any discussion on this? Suppose maybe first move forward, I indicated our meetings are typically 15 or 20 minutes when I was still on the job, so. Anyway,
Chuck, I just have one question. If I
yes,
could. Just because I know there's multiple people that applied for this. Just,
yes.
Can you just go through a summary of your interview process, just real quick, how you came across this candidate over at other ones?
I'm not going to share all of the reasoning and stuff, but the process was myself and administrator and our co-chair. And we had a list of questions given to us ahead of time, and we went around those to each of the candidates and compared the answers. So everyone was hit with the same questions and listened to the same responses, and then we sit there and talked among ourselves. I have the ultimate authority. We all talked about ourselves and agreed on candidates. That's how we do it. I like to have more than just one head involved.
Okay, I just wanted, like I said, I know none of the candidates. I just wanted to know how,
Yep.
narrowed it down to the
Yep.
one you got.
Yep. Any other questions before I call the vote? Oh, Supervisor Omar. Okay, sorry.
I would request that, I'm assuming the individuals here that they come up and talk a little bit about themselves so we know who the individual is.
We'll leave it up to the candidate whether he would like to, if you'd like to just introduce yourself a little or something before they vote, and it's up to you, but I'd like to come up here, please, so we're on a live stream and we pick up the sound. Thank you.
I'm Dennis Bachman, as you see. Currently, I'm employed with Citizens Connected out of New Auburn as the CEO. We'll be retiring before the end of the year. So that's basically background. I've been in communication business side for 40 years, 30 years here in Wisconsin. Prior to that, I'm originally from Iowa. So.
Thank you.
Thank you.
Hey, any more questions? We'll call the vote then. Kane voted 17 yeas, 1 nay. So it is approved. And then next, we'd like, step on up again, you receive the oath of office, please.
All right, so if you want to raise your right hand and say, I, Dennis Bachman,
I, Dennis Bachman,
having been appointed to the office of County Board Supervisor,
having been appointed to the office of County Board Supervisor,
but have not yet entered upon the duties
not have yet entered upon the duties
thereof, swear
thereof, swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Wisconsin,
and the Constitution of the State of Wisconsin,
and will faithfully discharge the duties of said office
and will faithfully discharge the duties of the said office
to the best of my
to
ability.
the best of my ability.
So help me God.
So help me God.
I would just like to thank Dennis for stepping forward to do this.
Thank you.
Okay. Next, item 3 is the County Board Chair appointment to the Northern Regional Trail Advisory Committee. I will entertain a motion to approve.
Gilmore moves.
So who made the motion first?
I'll second it.
Who made the?
Bomar and Kelly.
Omar,
Kelly.
Omar
Okay,
and Kelly.
gotcha.
someone, please.
Student.
Okay, any questions or discussions on this? Okay, if not, then we will call the vote.
ATVs.
You go. Okay, your release. Okay, the vote is unanimous. The appointments are approved. Next, we move on to county administrator appointments. First one is the highway commissioner. Oh, Andy? Oh,
Yes.
yes, we need a motion.
Yeah.
Take a motion to approve.
Later, so moves.
Flynn seconds.
Okay, we have a motion and a second to approve the appointment to highway commissioner. We'll have discussion.
Yeah, I'm recommending Chris Elstrand as the new highway commissioner. Start date would be August 18th. I think we're fortunate that we're able to have somebody that has a lot of experience within the county and with our highway department, as an extensive background period with 35 years in transportation and starting with the county 26 years ago. So I think otherwise his bio and background is in the board packet for you to have.
Any questions at all? Okay, then I will call the vote.
Sorry.
Tom? Perfect. Okay, all right, release. Vote is 18-0, unanimous. Appointment is approved. Congratulations.
Thank you. I appreciate the opportunity. I'm looking forward to the challenge. It's something I always strive to get to, so I hope to keep everybody as happy as I can.
Good luck.
Yeah, good luck.
Thank you.
Well wishes.
Hey Chuck,
Yeah.
can you get a clicker?
On
We don't have anything programmed for him.
Yeah, sorry. Well, raise his hand.
You could if you want to.
Okay, item 2 on the county administrator appointments is for Health and Human Services Board. That's there before you.
Lot seconds.
Okay, we have a motion and a second to approve the administrator appointment to the Health and Human Services Board. Any comments, questions? Okay, if not, I will call the vote.
Sorry.
Okay. Vote is unanimous. The appointment is approved. Thank you.
Point of clarification, should
Yes.
it be April 18th of 2026 and not 2027?
The term it shows the term expires 2027. I don't know how long those terms.
Yeah, because some of these terms are weird. They're statutory.
Okay, that's,
And if that person isn't on the board, then we appoint someone else.
yeah, okay.
Okay. Now, the most controversial is a 5-minute break. But, so I just make an announcement here. We will end our live stream right now because we are going into closed session. We have 2 closed sessions scheduled, and there is nothing scheduled, no action taken after the closed session other than adjourning the meeting. There's no anticipated actions that will be taken after the closed session. So this is just a notice for the live stream that we will stop the live stream. And we will meet back here. Okay.
I forgot my students.
Right, yeah.
Also, if anyone is really hungry, I have some chips in the hallway here, but you have to go in the hallway. You can't eat them in this.
Yeah. There's birthday, graduation, something.
More or less. We're hanging around talking. Barn, bathroom, you go away.
Fan? Fan. We already don't stick.
I was
That Nate's
talking
just
about
made
the 3-hour.
an oil boat, butter,
Only halfway
seasoning,
there.
salt,
I don't think 2 things.
pepper, let it on the pellet grill.
It could take. The presentation.
I did that with the morels. I thought that was good with the morels, and I told Katie the next time I'm gonna try that with, see what that was.
Yeah. It just depends on economic development
Right.
committee. That's their job. You dig in.
My other friend who does foraging said he
I don't know.
Jim, mine.
Have a flavor for
How long have you been?
anybody being unfavorable or something. 30 years. That's
You know my sister, Claudia Christine.
makes sense.
Yeah, she retired.
Yeah, I thought it was better than morels. I do.
That was some
Oh, did you?
last 2 days. That was in Stevens County Board. WCA has a thing. County there's all. You know, yeah, but it discusses various things, and one of
Did she ever tell you I was
what's
in?
going on is like
Years ago.
put things in the rules that help you out. 'Cause,
Nice to meet you.
like when it got stuck, you're okay, well, the rules, there's something in the rules, but there's things.
Same lady voted. She voted me too. She said she votes against the process, not
Some of the counties have like, you can speak a maximum of 2 times, a 10-minute time, or you can, but at the moment,
All right, well, good to meet you.
yeah.
Yeah, because I know that she was in high school, never sure,
But that's part of what WCA does. Their lawyer, they're saying, you know, they've been through this recently with, you know, a couple counties. And they've kind of come up with a little bit of a template, kind of developed because of all this stuff, and something for kind of to look at. You can kind of look and give an idea of, oh, yeah, look at that section on defined county.
especially when you can take.
We sit there and do things, and because that's, I can find it. Yeah. It's either on the website or I can find it. Because that's part of what they do. They're, you know, they're trying to Yeah, it's, yeah. And I spent all night talking to one guy at the county board chair. I forget what, 4,000. So you can imagine the number of cats you try. Right on the border. There, I don't know which person. His wife is the clerk. And an HR clerk in HR, and he's been involved for a long time. And problems, just talking. They're running the county things.
That's all right. Yeah, we're working on third right now. It looks like, yeah. It's really nice stuff too, so, yeah. Kind of spread out to the
Standing desk.
yeah.
It's not bad.
Yeah.
Basically here, nobody sees us.
Well, that's.
No, stack it though.
You know, I know that sometimes people stand in the back. No, I don't like the process. I don't know, there's something wrong with the whole program. I can't even, pull up the, agenda. Yeah, no, I gotta vote for it.
That's awesome. Good.
Yeah.
It is.
It's still in public.
You know what, for 60 years, yes, I will. I mean, I never said anything to her, but it was kind of funny. But he said, yeah, right.
She has a nice surprise.
That's my cynical side, sorry.
No, but I mean, it's kind of. I'm gonna talk.
First drop it in rain every day. Underneath it, cut it,
No, I did, but the same thing is that, sometimes when it rains that way.
Where's your district?
Hello.
East side, I'm east. For Eagleton.
I know. I don't know about that.
Okay. 21 miles. Just stand up.
Yep.
Is W. Guys, I better go back to my gotcha.
So are we halfway done, you think?
Well, Zoom.
Thank you. Sorry, but I want.
What was that? The latest. Like 9:30, quarter to 10. That night we got the whole report.
Oh, yeah. Yeah.
Outside of that, I don't think I've ever gone past. No, 8:30. 2.5 hours.
I got a real important question to ask.
Ah.
Mics are hot. Mics are hot right
Less than an hour.
Just so you know, one of the girls from the habit, she's on the phone, she's muted. She can chime in while they're doing their presentation. I know, I like to read them.
You got your idea across. I mean,
Last minute. Somebody will have it. Now maybe this fall, 10 or 11.
Okay, if we can We can please find our seats, please, so we can get started.
Yeah.
It's a long day.
Find a second one.
I haven't.
John always sent his stuff, you know, it was all, you know.
Please.
We get
Official.
out very often.
Let's please find our seats so we can get started.
Need to get a bigger gavel. It makes them.
That's one of those.
Pretty weak.
It's kind of a high.
I think I could probably do it with my phone better. Better take my phone.
Yeah, it was. Are they silent rappers?
All right, Todd,
Okay, please. Everyone sit down, please.
the live stream might still be on.
It is.
Oh. Well, now they,
Burning my retina out from it.
but now I'm gonna be the one who.
Okay, yeah. Okay. This on?
I love it.
And down. Okay, I'd like to call to order, please, here. Thank you very much. Just thank you all for, this is going to be a long meeting, I know. I was given the option of making this 2 meetings, so it wasn't so long, but in the summertime, getting you find another day and everything, I thought, let's just get it done in once. Appreciate you being here, so bear with us. We'll get through these two items in closed session. So I think, so right now, I would like to entertain a motion to go into closed session.
Supervisor Goodman, would you willing to do that?
Yes.
The county board will convene in closed session pursuant to Wisconsin State Statute, Section 19.85, para 1, para E, deliberating or negotiating purchase of public properties and conducting other specified business whenever competitive or bargaining reasons require a closed session. Discuss and take possible action on Project Rabbit regarding potential purchase or lease of time and land, designated for economic development. Closed session to include Danny Eldorado, Lee Simonson, Doug Clary, Todd Paul, Brady Seidel, Stacy Dennis, Jeffrey Sandler, Charlie Walker, Dennis Bachman, any representative affiliated with Project Rabbit, and all county board supervisors.
Do I hear a second? Okay. We have a motion to second to go into closed session.
Yeah, do you want them to use their radio? Or do you want to just do
Well,
I mean, yeah, it's ready.
Mr. Administrator, we didn't get a couple back here. That was done.
Okay, so we have a motion to second to go in closed session.
Sorry, I didn't understand, I apologize.
And we'll call the vote. A roll call vote's required, but this has no, everyone, so it's a roll call vote. Yeah. So Supervisors Sedlitz, Shoebridge, Flynn, Kinnick, please make your vote. Okay. Okay, the vote is 17 days, so we are now in closed session.